So in this small video series, we are going to basically talk about osteoarthritis and knee pain and how to really go about it in the form of exercises. So there are only two treatments which have got a justifiable support with the literature, which the first is the conservative treatment. In conservative treatment, the first important thing comes is the exercises. So the first exercise being demonstrated by Dr. Manjeet, who is also a physiotherapist, is basically called a calf pump exercise. The first movement that usually the patient does is called a toe movement. So now when the patient does a toe movement, this is basically not a calf movement. Most patients that we see in the elderly age group usually do a toe movement and they say that they are actually doing active exercises. But the exercises is done in this manner, where you move the entire ankle in dorsi and plantar flexion, and then you can feel the stretch in the calf region. So this is basically the movement happening is the dorsiflexion, and now when you stretch it enough, then you go to a plantar flexion, and this is done quite slow and gradual, and then you feel the stretch coming down to the gastrosoleus or the calf muscle. When you pull it up towards yourself, you actually feel the stretch that is going back at the calf region, and this calf region is actually more important to de-strain or to basically deload, because this is the prime mover when we start moving, and this is one of the basic cause of osteoarthritic pain. So the third simple exercise that we are going to learn today is called isometric quadriceps exercise. Here we can easily get a rolled towel at our houses, or we can also use a specific foam roller which can be kept just underneath the knees. So the angle between the thigh and the leg is somewhere around 5 to 7 degrees. So in this exercise, what we ask the patient to do is to basically press down on the towel. So when the patient presses down on the towel, the heel basically rises up from the bed, and then you can do active calf pumps and take your foot towards yourself. That's basically called dorsiflexion exercise. Count to 10 and leave gradually. So when you leave gradually, both the heels come in contact with the surface of the bed, and as soon as you try and press your knee down, both the calves basically get stretched, and there is a stretch in the muscle that is just above the knee, that's called quadriceps. So this is basically called the isometric quadriceps stretching exercise. The second most common exercise that is done and is told to the patient is basically called a straight leg raise exercise. So in this straight leg exercise, the patient is asked to press his knee down, and when they press their knee down, they can just take their ankle towards themselves, पैर का पंजा अपनी तरफ खींचेंगे, and then we will basically take this leg up. One of these legs has to be raised up. That is the important part, is that you don't have to raise it beyond at an angle of 45 degrees, because when you take it higher up, it really doesn't make that exercise useful. So the lower down it is, the more strength it takes. You can gradually count to 10 and come back down, and then you can relax for a 5-second break, and you can move your toes, and then when we can lift the other side, take the ankle towards yourself, and then you raise the leg. So this is basically called the leg raise exercise. We count to 10. We can feel the stretch at the knee and the muscle which is just above the knee. That's basically called the quadriceps muscle. So this exercise is basically there to recruit the quadriceps muscle in patients of osteoarthritis of the knee. So this is basically the third exercise that we are going to talk about. This exercise is basically called as heel slides. These exercises are given in post-operative patients of any knee surgery on day 1, and these are also done by patients who also have a chronic knee pain, that's because of osteo or any other kind of arthritis. In this exercise, we ask the patient to take their knee into a folded position, that is basically called a flexion. So the heel basically remains in contact with the bed, and because it remains in contact with the bed, this is also called as a type of a closed chain exercise. Gradually, once the patient holds it there, counts to 10, the patient is asked to bring it back, gradually keeping the contact of the heel and the bed intact. So this exercise does not load the muscles of the knee, and is basically a exercise to do a range of movement at the knee. So whenever there is a post-operative patient, we will always ask them to gain the range of movement early with the help of heel slides exercise. So this is another important exercise where in post-operative patients and in patients who have a hamstring sprain or a hamstring spasm, especially in any chronic condition of the knee which gives a knee pain, the muscle actually goes into a spasm. So these exercises basically stretch out the hamstrings. We ask the patient to keep the towel underneath the heel or the ankle, and we ask the patient to press their knee down. When they press their knee down, they should also dorsiflex their ankle. While they press their knee down, the hamstrings actually get stretched. Hamstring is a big, huge muscle starting from the hip. It comes down and crosses the knee and attaches at the base or the posterior aspect of the leg bone. So this muscle basically spans the entire hip and spans the entire knee. We can ask the patient to relax a bit after a hold of about 30 seconds. Gravity assisted hamstring stretches or isometric hamstring stretches are the same thing, and in this exercise we can see that. So hamstring are an important muscle. They are an antagonist to the quadriceps. Quadriceps is given quite a lot of importance, and most people actually forget about the hamstrings. Stretching out the hamstrings give a lot of pain initially, but that pain will settle down with ice packs, and this will relieve the knee pain and its stiffness. So another exercise that is important for this knee and hip pain is abductor strengthening. We often forget that this is basically a kinetic chain in which the entire leg from the spine to the hip to the knee to the ankle and the foot moves in synchrony and makes the entire movement. So in this kind of an exercise, we usually ask the patient to dorsiflex the ankle and take the leg up to about 45 degrees and keep it right there and count to 10. So whenever the patient counts to 10, they are basically stressing the muscle on the hip. Gradually this leg has to come down and the patient can leave the ankle also. Take a rest of about 5 seconds. A modification which makes this exercise slightly more difficult is actually called a anterior side leg raise. So in that anterior side leg raise, what we do is we ask the patient to flex the hip at the junction and bring the leg forwards, and now pick the leg up and move it to about 40 degrees angle and hold it there and count to 10. Once the patient holds it there and counts to 10, the anterior hip abductors are being strengthened along with the IT band stretching. The patient can gradually take it down and hold. That's it. So 5 seconds of rest is good. Then the patient can modify the same exercise which involves the hip abductors. Hip abductors are a very important part in the kinetic chain where we walk, and because of clearance of the ground that we need while we are walking, hip abductors form a major role. So in this exercise, which is actually for the hip abductor muscle, we initially ask the patient to lie down on their side, keep the hip in neutral position, and then raise the leg up with dorsiflexion of the ankle. Right? So we will keep the hip at neutral position right in the center. We'll ask the patient to dorsiflex the ankle, and at the side we'll ask the patient to hold it there for a count of 10. Then we'll gradually bring it down. This will also involve the quadriceps, the IT band, the hip abductors, and the ankle dorsiflexors, that is the tibialis anterior muscle. We can ask the patient to make it more difficult by asking them to come in the front, take the leg in the front and raise it to about 40 degrees and hold it there for about 10 seconds. We can come down gradually. We can also add dorsiflexion at the ankle, and we can come down gradually and take a 5 seconds rest. Now, to make it further more difficult and to involve the posterior abductors, we are basically taking the leg back and holding it slightly high above, and we'll ask the patient to not tilt and take it back. So this entire thing makes the exercise more difficult. So another important exercise for the patients of knee and hip pain is this called